Hi, I'm Steve Rowe, Executive Director, recording the weekly update. I'm recording on Tuesday, December 7th, and this will be uploaded and available to you tomorrow, Wednesday, December 8th. Today is the 80th anniversary of the bombing of Pearl Harbor. Our very oldest resident was a young adult at that time. About 10% of our residents were at least 10 years old, and many of our residents weren't even born yet. For my own family, my dad would have been one at the time of the bombing, and my mom was 6 months away from being born. My mother's father served in the Navy during the war, and my father's father stayed home maintaining roads in rural Wisconsin. I clearly didn't experience the hardships of our country being at war, and I'm eternally grateful for all who served our country, both in war and in peace times. It certainly seems that during World War II, everyone sacrificed in some way for the common good. People pulled together. Shortly after I started working at Oak Knoll, we experienced the 9/11 attacks on the World Trade Center and the Pentagon. Again, people pulled together, and our political differences became much less important. One of the things I've wondered about since the pandemic began is how it would have played out if we could have had the same sense of national unity to battle this invisible enemy of the virus that causes COVID. Instead, our state and national leaders politicized a public health crisis. The virus truly doesn't care whether you're a lifelong Democrat or Republican. It just wants to find its next host. I'm proud that those of you who live within the Oak Knoll community made decisions about vaccine acceptance and masks in a way that respected the science rather than the politics of the pandemic. Thank you for that. You certainly made our lives as leaders much easier than some of our colleagues have experienced across the state of Iowa. I also believe that that has been the key to the success that we've experienced here at Oak Knoll in fighting the virus. I'm happy to tell you that we continue to be COVID-free within our resident population. There is currently one employee who is off work because they tested positive about a week ago. There was no possible contact with any resident, so we did not have to go into outbreak status and test our residents in the health center and assisted living. But we currently do have one employee out recovering from COVID. Cases in Johnson County continue to be much higher than we'd like. I updated the case count tracking on Friday, and we reached a current surge peak of 77 new cases per day on November 22nd. So the data was available through November 30th, and it showed that from November 23rd through the 30th, there was a slight downward trend from that peak of 77 new cases on the 22nd. I don't get too excited about that though, because it seems like every time I go in and update the data based on what's reported, there will be restatements of that data, and oftentimes, almost inevitably, those restatements will show higher numbers. So we know that as of November 22nd, the 2-week period prior to that, there were a total of 905 new cases in Johnson County. So for that previous 2-week period. So clearly still a lot of activity. We just encourage you to continue to be cautious. Wear your masks, stay in your circles that you're comfortable with. If you do go out into a crowd especially, please wear your mask and just keep doing what you've been doing for 21 months. It has worked so far, and it will continue to work. Last week, Kim talked some about the new Omicron virus, or Omicron variant that was first observed in South Africa. We just received a release from the CDC, or Kim found a release from the CDC that was published yesterday. And in that release, they indicated what states the Omicron variant had been found in, and 18 of the 50 states have this new variant. Iowa is not yet one of those 18 states where the new variant has been found. And the CDC statement that came out yesterday really didn't say anything. It says, "We don't know yet how easily it spreads, the severity of illness it causes, or how well available vaccines and medications work against it." It also said that despite the increased attention of Omicron, Delta variant continues to be the main variant circulating in the United States. So I certainly don't have any inside information. What I am hearing and what I'm reading seems to indicate that the new variant is even more contagious than the Delta variant was, but seems to be causing less illness within the people that are infected. So we don't know. Only time will tell whether that is just wishful thinking, what we hope to be the case, or if that is in fact the case and we are starting to see less threatening strains of the virus. I think that's enough about COVID for today. That's pretty much everything I know. December, that's hard to believe. We're at December 7th already, but December is always a busy month around Oak Knoll. There will be lots of musical events and lots of good food. As a reminder, for your Christmas Day dinner reservations, those reservations are due by next Wednesday, December 15th. And we are absolutely looking forward to serving you and your guests. Kim mentioned that we had about 450 meals served at Thanksgiving. I would imagine we'll be at a similar number for Christmas. Also, next Thursday evening is the Oak Notes Choir concert, and I just want to call special attention and a thank you to all of you who participate in the Oak Notes Choir for coming together and making music for all of us to enjoy. Lastly, my son Tony and his fiance Alex, their wedding is this coming Saturday. So the first of my two kids will be married when I come back to work next week. I am planning to be off work on Friday, just helping with any last minute things that need to be done and preparing the venue for their wedding on Saturday. And I guess that's it. I hope you're all doing well, and we'll see you again in a couple of weeks. Take care.